It's just a few minutes after 5 Central Time, a few minutes after 6 East Coast time. So welcome everyone. Janine, would you like to go ahead and get started?
Okay, well, hello, my name is Janine Gleba. I'm the Advocacy Manager at United Ostomy Associations of America. I have the privilege of being your moderator tonight, and UOAA is very excited to partner with Byram Healthcare to bring you this special session on ostomy supplies and your rights. Okay, Brett. So as all of you know in the audience, how important it is to have the proper supplies for your ostomy so that you can live a vibrant life. Some of you might even know what happens when you don't have the proper supplies and your life could be hindered. You might end up in the hospital with medical consequences like severe peristomal skin complications. And so for us at UOAA, access to supplies is a huge advocacy issue. And so tonight we're gonna hopefully talk about your patient supply rights, educate all of you on the what's reasonable to ask for, what you should expect during the surgical experience, as well as gain a better understanding of the supply ordering process. We're joined by a terrific panel of guest speakers, and I'm going to let them introduce themselves, and I'm going to send it your way, Brett.
Thanks, Janine. Thanks for kicking this off. You do such a great job. And your organization does such great work for the ostomy community. So good evening, everyone. My name is Brett Cromer. I work for Byram Healthcare as the director of our Center of Ostomy Excellence in Downers Grove, Illinois. So what does that mean to you? So we have a team at Byram that if you are an ostomy patient and you are placing a reorder for your supplies and you would like to talk to a live customer service rep, that's the team that I get to work alongside every day. So I say I get to work alongside with them. It's really a privilege. So I've been with Byram Healthcare for about 3 years, but what most folks don't know is that I've been part of the ostomy community since ostomy surgery a few years ago, I should say, when I was 16. I've also been involved in a local support group here in Downers Grove that I've been running for, about 30 years or so, since my mom drugged me there when I was a teenager. So what all that means to you is the chance to do an event like this is really a privilege, and I'm very appreciative of all of our guest speakers that are with us tonight. We encourage you to listen to what we all have to say on the input and then ask a lot of questions of us at the end. And we hope you walk away from today with some additional information that no matter where you are on your journey of living and thriving with an ostomy, because we know that's different for everyone, we hope that we can use this time to help improve your quality of life. So Steve, would you like to go next?
Good evening. I'm Steve Van Dievender. I'm an ostomy of 24 years, have an ileostomy. I am president of the Peoria, Illinois chapter of United Ostomy Association for probably the last 20 years.
The sound is on.
I have spent the last 40-some years in medical sales from orthopedics to wound care to ostomy. For the last 8 years, I worked for one of the major manufacturers of ostomy appliances. And I retired in December. So I kind of speak from patient viewpoint, also from the manufacturer's viewpoint, and also from the support group viewpoint. So happy to be here.
Thanks, Steve. Liz, would you like to go next?
I'm Liz Hiles. I am in Cincinnati, Ohio, and I'm president of the local ASG here in Cincinnati, the Greater Cincinnati Ostomy Association. And I am a urostomist due to bladder cancer diagnosis almost exactly 5 years ago.
Liz, thank you. Really glad you're on with us tonight along with Steve. And Alyssa, welcome. Glad you're on with us tonight. Why don't you introduce yourself next?
So my name is Alyssa. I live in the Chicago area. So I am very familiar with Brett over here. And Liz is a good friend through UOAA. From the conferences that I so often attend. I don't lead anything within the UOAA technically, but there's always people, around because I'm a goofball and everybody knows that. And I would like to apologize in advance. I'm currently in the hospital with sepsis, so I may have a doctor or two come in. So I would like to apologize in advance.
We can't thank you enough, Alyssa, for coming on. Not in a million years would I jump on a call like this if I was in the hospital. So
Boy,
And
I'll second.
I got some
I'll second that.
awareness pins too. I even had my mom bring them from home.
Ah, awesome.
Sure,
Awesome.
I'll second that, Janine. So Alyssa is being very modest in that she's been a part of many support groups. She's been a mentor and really a good advocate in the ostomy community for a long time. And while she formally doesn't have a title with any of our organizations, she is definitely a champion for
Yeah,
ostomates everywhere, and super perseverance for being on with us tonight. So
right.
thanks, Alyssa. Janine, you wanna
Everyone,
hand it back?
everyone on this call is a strong advocate, in my opinion. So before we get started and dive into the actual discussion and presentation, I wanted to give a little bit of background regarding World Ostomy Day and why we're here. Every year in the United States, on the first Saturday in October, we celebrate Ostomy Awareness Day. And coincidentally, every 3 years, it's World Ostomy Day. And this year it falls on October 2nd. And the European Ostomy Association declared the theme or motto for this year to be "Ostomates' rights are human rights, anytime and anywhere." And all of us at UOAA were very excited for this theme, especially my advocacy committee, because for years we've been working on an advocacy initiative for the Ostomy Incontinent Diversion Patient Bill of Rights. So that's kind of what the focus is for this particular session. I just want to give a little bit of background on the Ostomy Incontinent Diversion Patient Bill of Rights. So these rights define and provide a guide to patients and healthcare professionals as to what the best practices are when receiving and providing high quality ostomy care during all phases of the surgical experience and then for the lifespan of living with an ostomy. And I wanted to give a little bit of background too, that these rights, sometimes we get caught up in semantics in meetings. They were not legislated, they're not a law. But to give an analogy, many years ago, the American Hospital Association were working on the Patient Bill of Rights, and they were never federally legislated either. But with a lot of grassroots advocacy, a lot of patients asking for these things, maybe in some cases demanding them. We don't like to demand things, as well as surgeons and nurses and primary care physicians recognizing these things. Eventually they became standards of care in the hospital. And basically, if you walk into any hospital today, you will see those Patient Bill of Rights hung up on a wall somewhere, if not in every room. Since then, a few states have mandated them, that they are required by law to take place, but it's not necessary now in all the states because they've automatically become standards of care. So that's the kind of change we're trying to drive at UOAA, because we, get a lot of calls and, contact forms from people who have received poor care or inadequate care, as well as, really struggling to find a proper medical professional to help them care for their ostomy. Because, many people live in an area where they don't have access to a WOC nurse, or they don't have access to an outpatient ostomy clinic. And I can tell you that, we are starting to see a lot of success stories. We are starting to see change. We do know many clinicians are starting to utilize the Patient Bill of Rights. So we just need to continue the momentum. And that's what's so exciting about this being the theme for World Ostomy Day, because, the whole public around the world, we're going to hopefully help make everyone understand that health is a human right. And of course, raise awareness and, increase, public acceptance of this life-saving surgery. Okay, Brett, you can go on to the next slide. So before, again, we dive in, I'm just going to show you what the supply rights are that are on the Patient Bill of Rights. And then we're going to stop sharing the slideshow and we're just going to talk to our panelists. So on the, most of these fall under the post-discharge section. So someone that just had ostomy surgery before the discharge from their acute care facility, they should be receiving information on the variety of product choices available from manufacturers. And I can tell you, I know support group leaders, I know the calls that we get, many people do not know that. They think what they leave the hospital with is that's it. That's all they have. We're still, I know a support group leader, and this didn't happen 20 years ago. This happened within the past year. She had a new member attend a support group meeting, and the person was released from the hospital 3 weeks prior. They were still wearing the same pouch. They didn't even know they had to change their pouch. And so these are the things that we want to see changed and happen. If for anyone undergoing the surgery in any type of healthcare facility. Next slide, please. Again, information about the supply ordering process. Many people leave the hospital not knowing how to order supplies. And so we want ostomates to be recognized and treated and given the same focus and quality care. For example, that someone has diabetes. No one with diabetes would leave the hospital without knowing how to order their insulin. And so we want that to happen for people with an ostomy. Next slide, please. Resources for obtaining supplies specific to patient circumstances, uninsured and underinsured. So those are certain subset population of people living with an ostomy. One of our highest volume of calls are those that are underinsured. And what that means is they have a health insurance plan, but they might have selected a plan on the marketplace that had a lower premium, but they have a very high deductible. And many people end up stuck having to pay for their supplies practically the whole year until they reach that deductible. So they're contacting us on how they can get supplies. We also get many calls from people that, no longer have insurance. They lost their job, they don't have insurance. Immigrants, they call, they don't have insurance, and they're looking for how they can get supplies. Next slide. And then the last one is related to, living with an ostomy, during the lifespan, a long time. And it's very important. Again, like I said, access to supplies is a huge advocacy issue for us, that people have access to specific and individualized ostomy supplies chosen in consultation with a healthcare professional to achieve and maintain a reliable fitting pouching system. And you'll probably hear some examples of, how it ties into this particular right. Okay, so again, we thank you all for choosing to spend your time with us tonight. And, we are always saying that ostomy education doesn't stop in the hospital. It's ongoing. So we really appreciate all of you being here. And I am going to ask my first question to Liz. So after your ostomy surgery, were you aware that you were not restricted to what was given to you in the hospital, and like that you have a right to choose other products?
I was. I had an excellent wound care nurse, and she discussed options with me. She asked me if I wanted to try things, and I personally opted to wait until I was home and healed and done with chemo, because the first pouching system that she put on me was working just fine at that time. And I didn't want to switch things up too much with what was ahead of me with my treatment. So I kept with that. But over the years, I have tried other pouching systems. And so far, I keep going back to my original pouching system.
Yeah, okay. Alyssa, did you leave the hospital after your surgery, like knowing that did you also receive like catalogs from the different manufacturers and actual hand educational materials on this information?
Yes, so I left the hospital very well informed, because my WOCN was none other than Jan Colwell, who is well known in the ostomy community and around the world. And then the advanced practice nurse at that surgeon's office was also immensely helpful. She was the one who got me hooked up with UOAA. And so they helped me even like order sample products that I could try. I did still end up with the same brand anyway, but it was worth like trying and seeing what I liked.
So. That's good to know that it is happening out there. Again, hopefully we can educate clinicians. We had a session last night, making sure that, when they have a new patient, that they do receive this sort of information. Brett or Steve, did you want to add anything, or should I move on?
Well, Brett and I go back to, we've had ours for so long that there wasn't as many things back in the days when we first got them, especially in Brett's case. But because he and I both had ET nurses, intrastomal therapy nurses, instead of WOCNs. But still, I was trained very well, and I used what I used in the hospital because it worked fine. until I became involved with UOAA and then started finding out about some of the other things that were out there. So.
Next question then, how have your supply needs changed over time, such as with possibly a new medical condition? I know probably not so much these panelists, but I know as people age, some people develop arthritis. They no longer have that dexterity to be able to like cut wafers. I know, again, people might start losing their vision, harder to see things. Again, they might need to get their system reevaluated. Has anything like that happened to you? Liz?
Not so far. I did have an instance during chemotherapy where part of my treatment caused my urine output to come very rapidly, which I was not really prepared for appropriately at that time, being 2 months post-op. And my chemo nurses were used to working with people before they had their diversion. So neither were they prepared to deal with that. So I did have an accident during my first round of chemo and just made the adjustment to actually bring an overnight Foley with me for my chemo treatments. That way I had a larger period of time before I needed to get help to get up and go empty everything, especially since the biohazard effect is magnified by chemo. So I wanted to cut down on the chances of other people coming in contact with my output to a minimum. I do know others that have had to readjust as they've gotten older due to sight issues and arthritis and things like that.
Okay, Brett, did you want to talk a little bit about like insurance changes?
Sure, I'll piggyback on what Liz said. I think we certainly have the experience to talk with a lot of patients, and we do have calls from time to time with patients that are going through chemo that, gosh, they swear that their new output is just eating right through their pouches. And we try to help assist them to get something a little different, try something different. And we all know how different everybody's output, skin, diagnosis are. And we get calls, we have a lot of experience with patients that the call goes a little like something like this. Gosh, I've been an ostomy patient for 10 years. I've always changed every 4 days. And now I have to change every day. Maybe the pouch is defective. And oftentimes after talking with them, it may be because of chemo, maybe because of some medication that they're taking. It may be because they lost or gained weight. I don't know about anyone else on the call, but I am not the same weight as when I was 16 years old and had surgery. Some folks are bigger than when they had their surgery. And oftentimes some folks, they've lost a lot of weight because of that sickness or the medication. And as we get older, our skin changes. My skin certainly isn't the same as it was 35 years ago. And sometimes that change in skin can maybe have a reaction to your supplies. One of the other challenges as folks move through different jobs, in and out of maybe having insurance, maybe not having insurance, maybe being covered by Medicaid, maybe changing from a commercial plan that they've been working for Boeing for 40 years and now they're on Medicare. Maybe they don't have a secondary. All of a sudden, they've gone from requiring very little documentation to having their supplies to falling under Medicare guidelines that allows for pretty much 20 changes per month. But if you need more supplies than that, there's a whole new process to go through that can be cumbersome and challenging when you're going through it for the first time. I think change is difficult for anyone, but most of our ostomy patients, we're used to change. We're resilient. We're used to advocating for ourselves. But changing insurances, if you are expecting it to be exactly the same as what you've been doing for the last 2 years, 5 years, take some time to understand how your insurance plan covers those durable medical supplies, because you may all of a sudden end up with a copay, especially on Medicare. If you don't have a secondary, you're going to have a 20% copay once you hit your deductible. And if you've never had a copay before because you worked for a company that paid for all your supplies, that can be a big shock. Maybe you have enough money to cover it, maybe you don't. But those are some of the calls that we get when the insurance changes. And Medicaid plans, for example, they can change. Your status on Medicaid can change from month to month, and you have to be an advocate for yourself in order to avoid any supply chain interruptions with your supplies. And most of the suppliers, they just want to help you get your supplies. There's nobody that wants anybody to be without ostomy supplies.
Great, thanks, Brett. The next right that we briefly mentioned earlier was before being discharged, information about the supply ordering process. So this is to Liz and Alyssa. Did you receive instructions prior to the discharge from your surgery? And then if not, how did you learn how to order your supplies? Alyssa, you want to go first?
Sure, yeah. So I was given, I was kind of like walked through it actually on the computer with my WOCN. So for me, it wasn't too bad of a process at all. Like I knew which company they had checked into for me, like which distributor companies were within my insurance. Yeah, so that was really helpful. So I think I was more fortunate than most coming out of surgery with my personal medical team. So I got lucky.
Liz, did you want to add anything?
I actually received instructions on how to go about and get that set up. However, I ended up with complications from my procedure and was hospitalized or in rehab for 2 months post-op. So by the time I got home, I had to find all the information all over again because it had been packed up and moved around several times, and B, forgot exactly what I needed to do. But fortunately, since I do have the amazing Patty Burke as my wound care nurse, I was able to just call her and say, hey, I just got discharged to home finally. Like, I can't remember what you told me to do. And she was like, okay, do you still have this? Do you still have that? And I was able to say, yeah, I just found it. And she was like, okay, just call this number and have your supplies near you so you can tell them the numbers off the boxes and they'll get you all set up. So
great. Yeah,
I had a lot of help, but I think sometimes maybe going over some of that information pre-op would be helpful, because for someone like me who lives alone and doesn't have like just one caretaker, when I'm in a situation like that, it's really challenging to remember those things and keep up with everything when you're being transferred to different facilities.
Thank you. And for those, established ostomates, in the audience, I would like to recommend UOAA created a toolkit, and it's a Know Your Ostomy Supplies checklist. And, if you print it out, it's very helpful for you when you're ordering your supplies, or if you're going to meet your primary care physician or a gastroenterologist to get a new prescription, if you bring that with you. I know we hear that a lot of regular doctors really aren't familiar with ostomy supplies or anything like that. So if you complete that form, it would be helpful to you. And the other question I wanted to ask is, do you have any questions about the supply ordering process, like today, such as like what documentation do you need to provide to order your supplies? So I'll start with Liz, and then I'm going to throw it over to Steve and Brett, because they probably know more specifically what actually is required.
I actually used to work in a pediatric GI office prior to my diagnosis. So I knew the steps prior to my diagnosis and helped a lot of the families that my doctors worked through. And we actually started putting the Know Your Ostomy sheet and filling it out for new parents of short bowel patients that had ostomies when they were going home from the hospital from the NICU.
Great.
So we were utilizing that very heavily, and it is helpful for them to, sorry, cars outside. It's helpful for them to kind of keep everything in one spot and be able to say like, oh, here it is. And then knowing that I had options to appeal if something wasn't covered, or contact my doctor's office and ask for a letter of medical necessity with office visit documentation and things like that. So if I think I'm going to need changes in something, I make sure I bring it up during an office visit so it's documented in the office notes. And that way, when it comes up and there's some obstacle with an insurance change, or if you're on Medicare or Medicaid, they change their policies all the time. So sometimes you'll have things covered and then 3 months later they're saying it's not covered, so you have to go through the process. So just kind of keeping track of all those things and making sure you're bringing up any prospective issues when you talk to your doctor during visits is important.
Thank you. Brett, did you want to add anything?
Yes, Janine, Liz, those are great comments spoken by someone that has been through the experience and knows, what the suppliers need to help our patients, help every patient navigate through there. But I'd like to add a couple things, tag on to exactly what you were saying with first Medicaid. You're right, the Medicaid Medicaid varies definitely by state. You may have little things like you are on Connecticut Medicaid, but you see a doctor in New York. Well, you need to have a doctor in Connecticut sign off on your prescriptions or have them do the documentation. If you're in New York, suppliers require hard copies of those prescriptions, not faxes. So there's little things like that that as you get experience with this and learn, you get better at. There was a specific question from somebody in the audience about a Medicare overage and what's that additional process. So Liz, you hit on something, but why don't I take it from a process perspective? So if you're ordering from a supplier and Medicare is allowable, as we talked about, is pretty much 20 changes per month. So if you're changing every other day, you're fine. If you're changing every 3 or 4 days, Medicare provides plenty of supplies for what you need. If you are changing every day, or if you're a patient that's changing twice a day because of skin, because of chemo, for whatever medical reason, you're allowed to place an order for more of those supplies. And then that supplier will start processing that order. They would ship you kind of that Medicare allowable to get you started. And then they would reach out to your physician to acquire an updated prescription and acquire exactly what Liz was talking about, an office visit chart note that says, Mr. or Mrs. Ostomy uses X amount supplies per day, and be very exact about the quantities. And then they require, why do you need them? For a medical reason, not because you don't like the smell or because you don't want to touch it. It needs to be a medical reason. And most physicians can walk through a medical documentation of why. And once that supplier receives those notes back, they can process the rest of the order. And then their job is to process that through Medicare, make sure they have that documentation on file for when Medicare comes back to audit them.
Yeah. And just also stress that, your nurse can write a letter of medical necessity. Your doctor might write that letter of medical necessity. Doesn't count with Medicare. They need to be in your chart notes, your medical record documentation.
Right. And I'll add one other thing. You're right, Janine, it needs to be in the medical record. And you need to visit that office once a year. If you haven't been to see your physician or a physician for 2 years, they won't work. They will go back and accept it for up to 6 months previous, and then it needs to be renewed on an annual basis. And it doesn't have to be that surgeon. It doesn't have to be the WOCN. It can be your primary care physician. There just needs to be somebody. Medicare just wants to know that you still need them. In its simplest terms, they just need to know how many you need and why you need them and what the medical reason is. And if you can't provide that, they're going to limit you to what the allowable is. And I think there was one other piece you were talking about, what info to supply or have ready for your supplier. I know this sounds crazy, but when you call up to change suppliers, if you're a new ostomy and you're trying to figure out where to buy your supplies, do your best to have all your information, contact information, backup contact information, your insurance card, and all the item numbers that you can possibly find. So it's challenging if somebody doesn't have all that information to diligently and timely process that order. Every supplier wants to get your supplies as quickly as possible. And the more information you can provide, the more timely that they can process that order for you.
Okay, thank you.
Sure.
The next right was resources for obtaining supplies specific to patient circumstances, like for those that don't have insurance or that are underinsured. Steve, I know you have a lot of good stuff regarding this since you worked at a manufacturer.
Well, for those of that have no insurance whatsoever, all three of the major manufacturers have programs available to provide free supplies for patients for a period of time. It's not it has a definite period to it. You're not going to be able to get them forever. So the companies themselves will be able to help. Also, as a president of a support group, I know that most support groups have a closet of supplies that they've picked up over a period of time with people passing or other changing of supplies. It's because I know I get calls quite often for people asking for supplies from my support group. And then there are organizations that are out there that's what they do. So you can get that information by calling the office of UOA or ostomy.org as far as the website's concerned.
Brett, did you want to add anything to that?
Sure, Steve, those are really good points. The other resource that you can find out here is for most of the suppliers have two things. If you're underinsured, so if you have insurance and you have chosen a plan that has a huge deductible or a huge copay that you cannot financially take responsibility for, you can go to their websites, you can talk to their billing teams, and you can apply for a hardship waiver, if you will. There is paperwork to fill out, and every supplier has these options, and you would just need to be approved by that particular billing department. And I thought Steve did a nice job of walking through the other options that are out there as well.
Yeah, and I'll just like to add, Steve mentioned the ostomy.org website, that we actually have a specific webpage that lists low cost providers. There are some suppliers out there who don't accept insurance. It's only out of pocket. So sometimes they have some products that are a little bit less expensive. We also, again, like Steve and Brett were saying, we list some of the suppliers, manufacturers on there. Again, there are certain private Facebook groups that have stuff. There's like Ostomy 211. I'm trying to think, like Kindred Box. So we have a whole list of resources for people who find themselves in that situation. And these are all like temporary things. It's not like a permanent solution. So, but it is a resource if you ever actually do need it.
Sure, Janine, I'm sorry, Gina, to interrupt.
Okay.
Just maybe there's two more points to add on top of that. Most of the suppliers so if there's somebody that does not have insurance, most of the suppliers have a discount cash program as well. And then the other piece, gosh, I'm sorry, I had something else right on the tip of my tongue. Oh, if there's an insurance change. So one other thing to ask and inquire with your supplier, if you're changing insurance because of a life-changing event, please double check with either your insurance company or the supplier to make sure that they are in network. Some suppliers carry 95% of the plans around, and some of the suppliers don't contract with every insurance company. So it's important to understand that as well.
Okay, so the last section, I actually have a bunch of things I'd like to throw out to all of you. And this is basically more for, again, established ostomates and people living with an ostomy, ongoing. We kind of covered everything that should be happening during the surgical experience, but now this is when the day-to-day living with an ostomy. What do you recommend people do if they don't have access to the supplies that they need, such as their insurance company has an in-network supplier and that supplier doesn't carry the brand that the ostomate might need? I think we already covered overage, but that's a good example. We do know some people that, again, they're restricted to a certain supplier, so they have restricted access. And how do you recommend people do that? I wanted to start with Brett. You want to go?
Sure. So from a supplier perspective and from a patient perspective, if you are working with somebody that says they don't carry your brand of supplies, it's important to talk with your insurance company first. And we talk about this a lot. Most ostomates are resilient and they're good self-advocates. Some are a little bit shy about standing up and raising their hand. Talk to your insurance company. Be very specific about what you need, why you need it. And let's not forget that we're the customer here. The ostomy patients are the customer. Get with one of the supervisors at your insurance company. Again, be very specific with the manufacturer number of what you're using. If you've tried other products and they don't work, the insurance companies, they want to help. They want to provide. You can start with your conversation with that supplier or ask if you can choose another supplier as well. There are choices out here.
Yeah. And you might have to, again, with advocating, and it's a pain in the neck, it's a real hassle, you might have to go through, most insurance companies have an appeal process. You might have to, go through that appeal process to get what you need. Initially, it might be denied, but then, once you explain, you're going to end up in the hospital with us, some people, do take photos of their skin complications and, they don't, believe me, the insurance companies don't want to have to pay for hospital care.
Sure,
They'd rather.
Janine. Yeah, no, they're. I mean, I think on the Medicare, especially when patients change, we had a patient who has a continent ostomy that she caths and she changes. She caths her surgery is not classified with Medicare, so she has to have very special documentation and fought it for 2 years, and we fought right alongside her with Medicare to get
Yeah.
her daily changing catheter covered. But if she wasn't advocating for herself, it would have been much more challenging. So definitely something to consider.
I had this situation come up just this last week where one of the members of my support group was trying to get a particular product, and the distributor that she was getting them through no longer carried their insurance. So this is something that all of us out there can possibly run into at certain points in time. So that's where knowing what other distributors are around. I'm a big advocate of using local folks. However, sometimes local pharmacies don't have access to all of the different insurances that might be out there. So that's actually one of the advantages of the larger DMEs, durable medical equipment companies such as Byram, because they're going to have access to the majority of those companies. But so you may find out, say, hey, I can't get this anymore because I have this insurance. Well, you can possibly look for other alternatives of other distributors that may indeed carry that particular insurance or are authorized to utilize that insurance.
Thanks, Steve. Liz, do you have any advice for how someone can self-advocate, when they have issues with ordering supplies?
Well, one of the things, especially with this type of situation, that I would do is I would break out that Ostomy Bill of Rights and say, that's one of the rights on the Ostomy Bill of Rights is that you have the right to receive the supplies that you need. Whether it's a skin allergy, or I worked with a family who had a little girl that had 3 stomas within a very small area on her abdomen. And they were doing like 10 to 20 appliance changes a day because she had grown and the system that they had was not working anymore. And we connected her with a manufacturer who was able to work with the family, devise like a stencil for a wafer, and they ended up trying a few different types of systems. They found one that worked for them, and they got a custom system for their daughter. And even though it was customized, we had documentation in the office that I worked in. So we were able to do a letter of medical necessity and get everything approved by insurance. We were able to get that covered completely by insurance because she needed it, number one. And number two, it actually turned out to be a cheaper order because they were able to last those 3 to 5 days instead of changing multiple times a day.
Perfect example. Alyssa, did you have any advice for people to, self-advocate when they run into issues ordering the supplies that they need?
Yeah, I've had 2 different things happen. One was my insurance changed, and then they gave me the same brand, but like basically a bag that wouldn't stick on my body, and not enough of them. So that was a very clear issue. And so I had to have my doctor, write an appeal and explain that my skin condition was such that you can't just put anything on me. So I did have that happen. And then at one point, the company changed just slightly whatever recipe the adhesive was. And so then I had to go through the whole thing of doing all the samples again, seeing what would stick. So that was an adventure that I didn't appreciate.
Yeah, the whole
But I was,
trial and error thing. Yep.
yeah, but I was supported by a good team though, so that helped a lot.
Great. Thank you.
Some people out there might not know, but it was brought up last night on our call, which I had forgotten all about, is that an ostomy appliance is considered to be a prosthetic because it replaces the colon, just like a total knee, a total hip, and that kind of thing. So insurance companies in Medicare it's coded under that. So we can get supplies. It may be a little bit of a fight as to the particular one, but we still not only have the right, but it is a law that they have to be able to provide supplies. I had forgotten about the prosthetic thing, and I found that very enlightening last night. So since we could have a wide range of people out there, I thought that was kind of an important point that people remember, that it is considered to be a prosthetic device.
Yeah. Thank you, Steve. But actually, my next question is for Brett. What should a consumer do because we get this at UOAA, if they receive a shipment of products that they did not order, and they've told the supplier that's not part of their order, they don't want it, and the supplier still sends it. I mean, if it's a Medicare beneficiary too, I mean, it's some ways it's almost like waste and fraud. They're probably still billing Medicare. So what can a consumer do in those types of situations?
A couple of things. It's a good question, Janine. A couple of things. First, open up that box. Oftentimes we get patients that don't open up their packages right away. So if they've gotten something, sometimes it's a simple mistake. Maybe somebody in the warehouse packaged the wrong item in there. Contact your supplier as quickly as possible and walk through exactly what the scenario is. You should be permitted to either send it back if it's something that is not that you didn't order, you should be able to send it back at the supplier's expense. If the supplier says, hey, go ahead and it's under a certain dollar amount, maybe they'll just tell you to donate it or give it away somewhere or toss it. And then you can ask to have it credited back if it's being billed to your insurance or Medicare. But I think it's important to send it back. So if you don't receive a label, so you should receive a return label or some kind of instructions for how to send it back. If that doesn't happen and you've gotten, and it's gone a little bit before that has happened, and you haven't received your return label, there is a return address on the inside of your packing slip. Send it back to that warehouse. If you get to the point where you're not getting that resolution or you keep getting orders, this is about advocating for yourself. Most of the time, there are folks at the suppliers. Ask for a supervisor, tell them exactly what's going on, get to the billing supervisor, get to the customer service supervisor, explain to them what's going on. Most Medicare patients, Medicare does not allow suppliers to automatically ship supplies any longer. So if you're ordering for somebody who passed away, just let the supplier know what's going on. Most of the time, they can resolve that and get it credited to your account. If something's been billed to Medicare, they'll credit your account and they'll credit back Medicare. The last thing the suppliers want to do is to be billing for supplies that are not being used or were sent in error. Janine, I also know that sometimes people receive supplies that weren't exactly what they were expecting. Maybe they ordered a skin barrier wipe and they've got a different brand. Same thing. Call back up, ask what happened. If a supplier is going to switch to a formulary label or a proprietary brand, they're obligated to tell you about it, to say, okay, Mr. or Mrs. Ostomy patient, we're going to switch this other brand that's clinically equivalent. This is what your insurance pays for, and you can try it. It may save everybody some money in the long run. And if it doesn't work for you, you can advocate to get the product that you are using. Does that answer your question?
Yeah, that's great. You actually answered my next question because it's one of our
oh gosh, you're right.
Advocacy priorities. We call it non-medical switching. It happens a lot with drug treatments and medications, but it also happens with medical supplies, not just ostomy supplies either. And for those that also encounter this problem, again, take Brett's advice there, but UOAA has a position statement on our website, and it explains the issue. We have examples from patients who it's happened to, or consumers, I should say. But you can share it with your insurer also. It explains there, for a lot of times, the majority of the population, the substituted product might work and it's okay. but there is a small population of patients who need a very specific type of pouching system. And if their products are substituted or switched, they could have severe medical consequences. And we talk a little bit about that on the position statement, some of those medical consequences. And again, the insurers, they don't want to be paying for hospital care. So again, that self-advocacy is so important. But I'm glad you talked about it, because I was going to ask that question.
No,
What
Janine, you make some good points, but maybe I should add one other piece here too, that that product substitution is driven by different financial reasons, and you have that choice. You suggested contacting the insurance company, who will then advocate on your behalf with the supplier. And the other thing is, think about it from a Walgreens versus CVS perspective. If it's a prescription drug, if you don't like the service that you're getting from a provider, you very often have the choice to choose and go to another provider that is not doing that medical switching. And I think that's important. As time consuming as that might be, it may be worth it for you to choose a different supplier who can take care of what you need.
Yeah, and that's what we're always saying with advocacy. A lot of it's, educating people, like that's not something we can make a law, and in the most cases. It's a matter of, again, speaking up and educating the supplier or whoever is doing this. Steve, I'm going to ask you this one. What can people
Well, before you do that, I just want to throw out one as an absolute last resort. You can always pay cash. I mean, you could always buy whatever product. Prime example, the silicone adhesive releasers, the sprays that are out there now for being able to make it easier to take your appliance off. Medicare doesn't cover that. They want you to use the wipes, but there are many people that indeed will purchase those products themselves because they feel it's necessary they have. So, I mean, you always have that availability of being able to buy it yourself.
Okay.
We don't want to, but we have that available. So
yeah. If it works for you. What can people do if they experience not getting the supplies they need because they're stuck with the formulary brand in the hospital or whatever the home health agency has on hand? And I say this because, down the road, someone might need a hip surgery and they're back in the hospital or end up in rehab. And if they're on Medicare, then the supplies fall under that bundle payment system, and it's provided by the hospital. So, but again, they might only have that hospital might only have Hollister, and the person needs Convatec supplies. Like, do you have any advice in these kinds of situations, or what can they do, or can they ask the facility to go out and get the supplies they need? Or
well, I thought you mentioned somebody who's maybe in there for a second surgery or they're going to have their own supplies. So you certainly can bring in your own supplies if you need. As an example, I can't wear one particular brand because my skin reacts to it. So that's part of the reason why I use the brand that I do. So if I were to go into a hospital and had to have a particular brand, I would say, I can't use that. My skin's going to react to that. So my only alternative is, and usually for home health, they will indeed get you what you need then. Maybe not initially. So you might need to bring in your own for a change or two, but usually they'll comply with those types of situations.
Right, Janine. I think Steve, those are really good points. I think part of the challenge is that hospital may be contracted, like you said, with Hollister, with Convatec or Coloplast. Get to one of the nursing managers and advocate. If you are the patient, advocate for yourself. If you are a caregiver, explain why you need this particular brand. And most of the folks at the hospitals, gosh, they'll do everything they can. Oftentimes they're buying from a distributor that may not carry those products, and it might take them a little longer to get them. But don't give up. Keep fighting for yourself. Get to it and do your best to get what you need.
Any hospital or any home health care agency can get anything that's out there. It may take them a little while to get it, but they still can get it. There's all types of avenues for them to explore. So if you have a medical need, they can accommodate you. It may just take a little while. As a manufacturer's rep, I used to get phone calls invariably on Friday afternoon saying, we're trying to ship this patient home, but we need XYZ and we need it now. And so that's where, I would get involved in those kind of things. But still, the point is, yes, they're contracted with one company, but yet if you have a need and you understand that, it can be obtained.
Great, that's good to know. This is more for Brett and Steve, because again, we at UOAA get these concerns from people and online too. And we know the ostomy community was affected by the pandemic, especially in other countries. But we want to know, is it still impacting supply and demand for ostomy products, such as shipment delays, or, well, if it happens to a consumer, what should they do?
So I think this is about being prepared. So one thing we talk about from time to time, incoming. So if there are products that are being imported, we're seeing some minor supply chain interruptions with a particular item here or there. Maybe you've experienced that. Nothing major. What we've mostly been experiencing lately is shipments that are leaving our warehouses that are going to our patients are being delayed. A little bit of being delayed by the shippers. We're receiving communications, and if you are reading the news and reading things right now, there is a distribution crisis in the United States. UPS and FedEx are trying to hire tens and tens of thousands of workers, and patients that normally receive their shipments in 1 or 2 days are now being told they maybe potentially expect that in 3 to 5 days. So if you're used to placing your order on Wednesday, having that order released and it shows up the next day, I think it's important that the whole supply chain is being disrupted by staffing and lack of enough people to deliver all those packages. And we're anticipating into Q4 that we're not going to see much improvement until after the new year, coming into the busy holiday time. So just sign up for every possible mode of communication from your supplier where they can keep you up to date with where your package is. Try to order a little extra if you can. If you're already ordering the allowable, make sure you've got your extra supplies off to the side, and just be prepared. Janine, one of the other things that we experience with patients is there's been some really difficult natural disasters recently with flooding, with fires, and with storms in the South. Gosh, if your distributor had a warehouse that's in one of those zones, you might have experienced some delays. But if you are a patient that has been impacted, maybe you've needed to move in with a family member, maybe you've needed to move 3 states away to be away from wildfires or floods, let your distributor know as soon as possible, especially if you have had to leave in a hurry and you left your supplies behind. Don't wait. Don't hope that you're going to get back in. Call your distributor and ask them if they can do something. Your insurance company can work with you to maybe get an order out and get it released early if you require documentation and authorizations, or that supplier can send you an emergency order to get you by.
Right. That's a good point with natural disasters, fires and floods and hurricanes and everything. Steve, what about the manufacturers? Is there anything that they do in those situations?
Oh, absolutely. If it was in a natural disaster, I would have authorization to be able to call the company and be able to get certain stuff sent into certain hospitals. If you remember a few years ago, Springfield, Missouri had a tornado that went through, and we were authorized to be able to go ahead and send supplies into the hospital in order to be able to help. If from a manufacturing standpoint, one of the hurricanes really did some damage for us, so we were delayed. So one of the things that I'm going to tell you is that have a stash, or try to have a stash of other stuff. I use one particular brand, but I always had. I told you I can't wear one of them. So the third company was kind of my stash in the back, in case for some strange reason I couldn't get something. I had a backup plan, or I had a backup situation to be able to hold me for a little bit. So, when things are going well, call a different company and ask for samples and that kind of thing. Or that's what, again, support groups are for, is manufacturers come in and do presentations about products, get other samples to try. So then maybe, and have them send you some samples, and maybe you only have 1 or 2 or 3 of them, but still that will certainly help if you get into one of those types of situations. So just like manufacturing of products is just like everything else around the world. In the shipping, like Brett was talking about, in one particular case, manufactured outside the United States, and so then they got to go through quarantine and that whole process. So, it is something that, from a manufacturing standpoint, caused us to have a tremendous amount of difficulty. But have a little bit of try to have some kind of a stash of your own.
Thanks.
I agree.
Liz or Alyssa, did you want to add anything else to the conversation before we open it up to questions and answers?
Go ahead, Liz.
one of the things I always remind people is not to forget about your local chapters. Like Steve said before, a lot of local chapters do have supplies that they keep on hand. And if someone is out of harm's way in your area or closer to you than a supplier, even if you have to drive an hour to meet somebody halfway or something, check with some of those local chapters and see what's available, or if anybody from those local chapters has any supplies on hand that they would be willing to donate or even take a small payment for in an emergency.
Yeah, and before Alyssa, before you jump in real quick, not everyone in the audience might even belong to a support group anymore, or never even thought to attend a support group. But UOA's website has a support group finder. So if you find yourself in a situation like that, you just type in your zip code and it would show you what support groups are near you in your area. Okay, Alyssa, sorry to cut you off.
Oh, no, you're totally fine. I was just gonna say, one of the things I've done in an emergency is to start calling up people, friends from around the Chicago area. Just kind of hitting them up for, just a few supplies, and then vice versa. But then also remember that Amazon sells ostomy supplies and you can have rush shipping on that. So in a pinch, that can help you get to your next shipment. And that's something you can do, like, even if you're on vacation, you can like have it shipped to your hotel.
Great, thank you.
Yeah.
Brett, I guess you can want to share the last couple of slides on the slideshow?
Sure, I can. We did have one question come in from the audience that I thought was appropriate to ask or to bring to the group here about odor neutralizer. So she was asking about, sorry, she'd just seen a patient in clinic who's going through chemo, whose stool, her output was much more, I guess the word is odoriferous. It smelled a lot more. All right, that's the technical term. So yeah, there are, if you've never used an odor neutralizer, we'll just share personal experience. So 35 years using an ostomy, 34 years and never used an ostomy deodorizer until I started sharing a bathroom with my little boy, who was less than happy that whatever, dad has an ostomy, he deals with it. But man, he said, haven't you ever tried one of those things that makes that odor go away instead of that terrible spray that you're using? So we tried. So we did what we suggest all our patients do. We called up Hollister, Convatec, Coloplast, OsteoFresh, and we got deodorizer samples coming out the wazoo. They all performed differently in our family, and we landed on one that has, well, in a simple word, and we don't throw this term around loosely, it changed our relationship, because that bathroom no longer smells, and I cannot go without this product anywhere traveling anymore.
Wow.
Probably would have made my marriage even nicer had I had that a long time ago. But I think it's important to try different ones. Oftentimes patients will try one and it doesn't work. You can call all the manufacturers, and Steve will vouch for this. They'll send you samples of it to try, and they want you to find something that works. So there are a lot of them out on the market. Most of them are, and almost all of them are covered by insurance, enough that you should be able to use that for the Medicare allowable allows for 3 8-ounce bottles of deodorizer per month, which might sound like a lot, but if you're emptying your pouch a couple times a day, you can go through a couple 3 bottles in a month. So hope that answers your question.
As someone who's actually experienced chemo,
Right.
I will say that when you are experiencing your output during chemo, that things affect you differently. It's part of the whole like connection with the nausea and the vomiting and all that kind of stuff. I could smell delicious food that my neighbors were making and would want to throw up just at the smell of it. And I had similar experiences with emptying my urostomy during chemo. So even though you're experiencing chemo right now, you may not necessarily need some of those products or sprays or whatever you decide to use after you're off of chemo. I adjusted to the smells, and unless I'm eating asparagus or something that makes normal people's urine smell very strong, then I usually don't need anything now. So how your body reacts to things while you're on chemo is going to be very different than afterwards. So even if you want a deodorizer after chemo, you may decide to use a different one instead.
Brett, we see your screen, what you're typing in. And someone was looking to get admitted into the waiting room, although we're wrapping it up now. Were there any other questions that were typed into the chat?
Did you see the question on there about how long their stash can last? That's kind of an important question. So the answer to the question is that basically all the manufacturers have expiration dates on their products. However, a pouch, there's not much that can deteriorate with the pouch. On the skin barrier, the adhesive might become a little less aggressive over a period of time, but part of the reason it's your stash is to kind of hopefully you're never going to have to use it. So maybe if you've had it for 2 or 3 years, then maybe it's time to move on. Mm-hmm. But the company I work for, we did not have expiration dates on the boxes, but yet we knew because of a code that was the lot number that we knew what when they were manufactured. But I really wouldn't worry about that too much because again, it's your stash and it's your emergency stuff, and maybe you're not going to worry about trying to wear it for as long as you would otherwise. So
that was a great question, Brett. There's someone in the waiting. It's been in the waiting room for a while. I don't know.
Let's take a look.
I just wanted to add something real quick about the deodorizers. Because I see these questions come up in a lot of the Facebook groups I am a member of. There's a decent chunk of people who recommend putting like peppermint essential oil in your bag. And I just wanted to mention that that's a bad idea because it can, like whenever it's in contact with mucous membranes, it can really, you really feel it.
Wow. And if anyone is interested in specific products, unfortunately we can't say that on this. Maybe, they can, Brett, you can share, Brett, if you want to share your email with people in the chat, they can contact you if you want to share what product you use. Unfortunately, we can't, we've been so cautious with saying specific manufacturer names. And
it's been very hard to do.
It's been very hard to do.
It's hard to do.
So, is there any other questions at this time? Otherwise, we'll wrap it up, and we thank everyone for joining us this evening. And really a big shout out, thank you to the panelists for spending time with us over the past couple of weeks, and then and this evening, and sharing your expertise and all of your experiences. UOA greatly appreciates Alyssa, Liz, Brett, Steve, and Andrew in the background for helping us. So we were very happy to partner with Byram, and hopefully we could continue the partnership down the road. So.
Thank you, Janine. This is great. So thanks everybody for taking time away from your work or family to be with us tonight. So we're proud to be partnered with UOA and do this educational piece for the ostomy community. So thanks for allowing us to be part of your evening.
Great. Have a good night.
And just real quick, sorry. I wanted to let people know, I see Brett and Liz and myself are all willing to be contacted after this. So we've included our emails.
I can put mine in there.
Yeah.
How do I change it? How do I change it? Just so that
people know to check the chat for those opportunities. Because I for one am more than happy to, connect with people, help them connect with the resources they need as far as socially. And I know Liz is really well connected as well. So hopefully that'll help some of you if you didn't get some of your questions answered today.
Great. Thanks, Alyssa. Have a good night.
Thanks, everyone.
Bye.
Good night. Bye now.